Let me tell you why I became a nurse patient advocate. I was working in the hospital as a wound ostomy nurse, and honestly, I had the best gig. I was able to go to work after I dropped off the kids at school, and I would get a list of patients that I needed to see that day, and then I was able to leave in time to pick up my kids from school. So it really was my last job where I clocked in and clocked out as a nurse. It was a great job. But this was back in 2015, and I really wanted to practice nursing the way I always envisioned practicing nursing. And so what that looked like to me is I really truly wanted to work one-on-one with clients and families. And maybe that came from me being a wound ostomy nurse because I was able to work with clients and families one-on-one. I would see them in the outpatient clinic. I would see them in the hospital. I would see them after their surgeries and do the follow-up. So I really got to know my patients and my families. So I wanted to do this for others too. So I envisioned like meeting with them, gathering their health information, and then going with them to appointments, helping the providers, giving them information. And so I sort of imagined this like all in my head, and that's what I started doing. Is I got my first client and I was like, wow, like this is real. And just to give you an example, it was somebody who needed the support that when they were going to their provider appointments, they wanted someone like me, a nurse, to be with them at the appointments to take notes and then also to help them with the follow-up. And so it was sort of just as simple as that. And that was like my first client. And then I received, another inquiry from somebody else who, they had elderly parents that they were trying to help and they just weren't sure what to do. And so I would go to their home, I would meet with them, I would listen, we would collaborate, we would come up with a care plan, options for them and resources. And it just felt good. And so this was in 2015. And fast forward, it's 2024. And I'm still a practicing nurse patient advocate because that is what I love to do. I love the flexibility of being able to, so to say, clock in and clock out when I want. When I want to work, I can work. And my clients, they're just as flexible as I am, along with everything I'm creating and doing is my own. And I enjoyed creating policies and procedures and workflows for the organization I worked for and the education material, but still it's so nice to create stuff that is unique to you. So I get to create the care plans, the medication lists. I get to do sort of the way I want to do with creating like notes. And honestly, the other thing that I love doing as a nurse patient advocate is the collaboration. And that is one thing I do miss from working in the hospital is I loved working with a team. I loved working with the hospitalist and I worked a lot with surgeons. So I enjoyed talking to them and getting to know like what they were doing for the patient and really understanding along with all the nursing staff. Like I enjoyed seeing the ICU nurses and the med-surg nurses and the ortho nurses. It was fun, and along with the dietitian. So we always collaborated with the dietitian on our patients because we knew that nutrition was important for wound healing and for ostomy care. And then we also worked a lot with the RN case manager and the social worker because we were coming up with, okay, like what is it going to look like if this patient is discharged home? Who's going to do their wound care or who's going to teach them to do the ostomy care. And then we worked with home health to make sure that the home health nurse knew how to do the wound care. Or maybe it was a difficult ostomy to pouch and, we mastered it, but the patient hasn't mastered it or the family. And, we would collaborate with home health so they too could understand how to do that care and teach. And so that's sort of like my background that led to me to do RN patient advocacy. And so just wanted to just tell you a little bit about my why and how I got here in 2024.